That's a red line. My friend and colleague, Senator Merkley's here. We're going to get everybody up, and then softball questions can come to me, and physical ones are my partner, Senator Merkley.
Thank you. Thank you, Mr. John. Republicans have shut down health care in order to, shut down the government in order to savage health care for millions of Americans. This is a families lose, billionaires win agenda. That's not what we should see in a government of, by, and for the people. We should see a families thrive and the affluent, millionaires and billionaires, pay their fair share. But this assault on health care is going to diminish the quality of life for so many. 2 days from now, the new rates are going to be put out that will kick in next year. We're expecting to see a 68% average increase here in the state of Oregon for people buying insurance on the exchange. Well, people think about inflation at 3% or 5%. We're talking about 68% or more on average, more than $1,300 a person for people buying on the exchange. And this attack on healthcare doesn't just affect people on the exchange. It also affects the cost of healthcare off the exchange, and we're expecting a projected 10% average increase across the state on people just buying insurance directly from a provider. And then, sitting in the distance, which is January of 2027, after the next election, is the attack on Medicaid. Well, in Medicaid in Oregon is the Oregon Health Plan. 230,000 plus people will lose their insurance here. Wow. So immediate near-term increases in the cost of the exchange and buying off the exchange, and then devastating impacts on the Oregon Health Plan. You know, in rural Oregon, 60% of the children get their health care through the Oregon Health Plan, through Medicaid. And across the state, a third of the families get their health care through the Oregon Health Plan. So what does all this mean? Well, of course, for those who have to pay a lot more, it means if they buy that more expensive insurance, they have less money for rent or a mortgage payment or to put food on the table, care for their children appropriately. But if they forego the insurance, then we're looking at folks who don't go to the doctor until they have a crisis. And then that means the emergency room. And that means the problem is much worse than if they'd been able to go earlier. So the health care deteriorates, and the cost of treating it goes up. And then, because they don't have insurance and can't pay the bill, the revenues to our clinics and hospitals go down. The Sheps Center has estimated that 300 rural clinics and hospitals will close as a result of this attack on health care across America. And when a town loses some dimension of their clinic, some program in their clinic or hospital, it isn't just the people who didn't have insurance that gets hurt, it's everybody in the town. And if that town is rural and you have to go down the road more than an hour, essentially the entire availability of quality, affordable health care has diminished. So we are in a government shutdown right now because Republicans wanted to launch this attack on health care. And Democrats said, hell no. And as long we are going to be out until health care goes back into the law and is returned to provide support for our families across America. When you think about the foundations for families to thrive, health care, housing, education, good paying job, it is an essential element. Why do our Republican colleagues feel that they can launch this savage attack on such a foundation for families? You know, some 2/3 plus of the folks who are affected by the cost on the exchange are in states that Trump won. And it's because they feel they're no longer accountable to the people. That's part of this authoritarian assault by President Trump. The two are connected. Healthcare and the authoritarian takeover of our government. The assault on due process, the assault on freedom of speech, the assault on our universities, the assault on our networks. All of this is part of this vision of a strongman state. And of course, we're very familiar with his weaponization of the Department of Justice, going after political folks who disagree with him politically, and the effort to send the military into our cities. So I just want to connect this assault on health care and why Republicans think they can do it. It's because they've come a rubber stamp for the authoritarian President Trump. So it is a billionaires win, families lose vision. It is a red carpet for the rich, and it's red tape for struggling families. We are going to fight that in every possible way. And a lot of that fight happens at the county level, and that's why I'm so pleased to introduce Lori Trigger, Lane County Commissioner, who has a particularly strong interest in addressing issues from addiction to mental health and basically the entire parameter of health care. Welcome, Lori.
Thank you, Senator. Thank you, both Senators Wyden and Merkley, so much for being here. I know this is a matter for all Oregonians and, in fact, Americans everywhere, but we are especially appreciative of your attention to the unique ways the rising costs of health care and health insurance impact folks here in Lane County. It's our honor to host you here at the Charnelton Clinic. This is just one of Lane County's federally qualified health centers here in this building, which in all serve approaching 30,000 Lane County residents. Right here in this building, we deliver access to primary medical care. We ensure families have the supports they need to meet their basic needs, including nutrition programs like WIC, the Women, Infants, and Children program, which ensures that pregnant women, babies, and young children in particular are well cared for. And we connect veterans to vital services that they need and deserve. We are proud to offer these direct services and more at Lane County. It's imperative that we maintain and even expand healthcare delivery and access in our community, as these services are critical and the needs of our neighbors are only growing. Locally, in the last 2 years alone, Lane County residents have experienced numerous facility and service closures and corporate takeovers of locally owned clinics. These include losing our University District Hospital, which among other things housed Eugene's only emergency room, as well as the ACE unit, or acute care for elderly. The Optum takeover of Oregon Medical Group, resulting in an exodus of primary care doctors. And just in the last few weeks, Oregon Medical Group's discontinuation of their OBGYN and maternity care services. These losses lead to even greater fragility in an already overburdened system. Increased rates of uninsured from the Affordable Care Act marketplace premium cost increases and stringent Medicaid work and eligibility requirements will further weaken our system. I know you're hearing the same thing, Senators, that I am from folks in our communities about the incredible pressures of cost increases across the board, the high cost of living from inflation, sticker shock at the grocery store and the gas pump, and the continued burdens of unaffordable housing, to name just a few. Now is the worst possible time to pile on with extraordinary insurance premium hikes. We cannot bargain away or compromise care for one group or for one type of service in order to provide it for another. We must provide care for everyone who needs it at a price point that they can afford. I know, Senators, that you believe, as I do, that every Oregonian deserves to have access to the care they need. So I'll close again by offering my gratitude to both of you for being here today in Lane County, for your work on behalf of all of our constituents and the entire state is greatly appreciated, particularly in these exceptional times when so much is at risk and so much is under threat. Your perseverance and your commitment to doing what's right for people is so greatly appreciated. And now it's my honor to introduce Bart. Yes, of course.
Just before we introduce Bart, we've been throwing some numbers around, and I just want to make sure everybody's clear. Monthly premiums are going to double for a lot of the folks that we represent. And we've selected several families to talk about how their premiums are going to go up much more. They're going to, in fact, quadruple. So as Lori said, now we're starting with one person who's very close to us and our office, the Armitages, and they're going to talk about premiums quadrupling. So we got people with huge hikes of all sorts, and now we're on to quadrupling.
Good morning, everybody. My name is Bartley Armitage. I've lived in Eugene. I moved here 45 years ago. I was a union carpenter, still am actually, but I retired. And my wife, Carla, is here with me. She's recently retired as a teacher, 4J school district. So she worked longer than I did. And so we used her insurance, which was pretty good for a while. But for her to continue with her insurance, which wasn't, they don't provide that for retirees. You have to pay through COBRA, the COBRA plan. Very expensive, not a good idea for us. I once had a subsidy for carpenter's insurance. That went away. They pulled that a couple years ago, so that wasn't an option. And so we went Affordable Care Act. With the subsidy, it was reasonably priced. We didn't get the best insurance. We didn't get the worst insurance. Fairly high deductible. Anyway, so then I find out about this plan to not continue the subsidy. And we got our letter already from MODA, the insurance that we took out. The options are pretty slim, and you have to pick from only certain options in Oregon. If you live in a different state, then you get those options. Here we get the options we had. So we looked it over. We chose a plan, and just for health, I'll just give it out a number. $443 a month was our payment with the subsidy. If we sign up for the same exact insurance starting in 2026, without the subsidy, our payment per month will be over $2,200 a month.
So that's more than quadruple.
Yes. So that's pretty ridiculous. I feel like it's cold-hearted and cruel what's happening with this so-called plan. The big, beautiful betrayal is really what it is. And all for the sake of propping up billionaires who don't need propping up. So disappointed, and hoping that I want to thank the senators and all the staff for being here and spearheading the fight, because I think it is a battle, and we got to keep fighting. So thank you.
Chris, thanks for putting a human face on what it means to see premiums quadruple, folks. These are not abstract questions. This is the real world of Oregon today. We've got a self-employed worker. Chris is next, and also an enormously important account.
Hey, thanks for being here. Thanks for having me. So I am a self-employed hairdresser, and my wife is a part-time dental hygienist. She's not able to get health insurance provided through her work unless she works full-time. We have two children, 10 and 13, that they need her to pick them up from school, take them to their activities and things like that, help with homework and stuff like that. So I do the full-time work. We've been using the Affordable Care Act ups and downs since it started, so I'm pretty familiar with that, how it works. I got lots of experience using that. We currently have like a Region Silver plan through the health insurance marketplace. Our premium is $700 a month, just over $700 a month, with a $1,000 tax subsidy. If that doesn't continue, our premiums will go from $700 to $1,700, not including any sort of inflation or rise in the price of the premium. And this insurance also doesn't cover my daughter's allergy shots. It also doesn't cover blood work for my wife, which is another couple $100s a month, because we can't afford a gold plan or at this time. So with that $1,000 a month that we don't have, my wife wouldn't be driving a 23-year-old car if we had an extra $1,000 a month. And so it puts us in a tough position. Our best friend's daughter just fell off her bike and broke her arm and needed surgery. They got a $42,000 bill from the surgeon, not including the emergency room. They have insurance, but even at the 20% that they pay, That's $8,000 more for that family. And so it puts us in a tough position to try to pay this extra $1,000, at least an extra $1,000 a month, or relatively healthy risk not having insurance at all and getting being bankrupted by a $42,000, bike accident. So I just wanted to share that with you guys. It's just not a good position. I think that we're just obviously going to have to figure it out the best way that we can as a family. But as a hairdresser and talking to like a lot of my different clients, part of the reason I wanted to be here is because I don't think that people really understand the aspect of being self-employed and having to get your insurance. A lot of people are fortunate enough to have insurance through their workplace, through the U of O or the city or the school district. And so I just wanted to share the prices and the cost of being self-employed and then trying to purchase your health care yourself. So thanks everybody for being here.
Thanks a lot, Chris. And compare what Chris just described to you to the billionaires that I've mentioned this year whose wealth has increased $1 trillion. Compare Chris to that. We're really lucky to have Ms. Gray here, the director of the Lane County Health and Human Services Program. And welcome.
Thank you, Senator. As the Senator mentioned, I'm Eve Gray, Director of Health and Human Services for Lane County. Lane County runs the largest federally qualified health center in our county. We play a critical role in delivering accessible, comprehensive health care services to underserved populations across our region. In 2024, our organization provided services to almost 30,000 patients, a figure that underscores both the scale and necessity of our services. Our health center serves a patient population that is predominantly low income and faces significant barriers to care. More than 91% of our patients live below 200% of the federal poverty level, and over 1/5 of our patients are uninsured. We have demonstrated a consistent and effective approach in serving individuals experiencing homelessness, behavioral health challenges, and with other highly vulnerable groups. In 2024 alone, our health center served over 3,600 individuals experiencing homelessness. But this mission to provide care to the most vulnerable members of our community is becoming harder to achieve. As many of you have heard, we have been operating at a loss for the last year, and we just consolidated 2 clinics into other larger locations to save on costs. Today, we have balanced our current budget without losing patient access, meaning we did not lose clinical staff as a result of these changes and continue to serve all of our patients. Achieving this goal of maintaining access, however, is becoming increasingly difficult. We face numerous headwinds to achieve financial sustainability, and more people becoming uninsured related to the loss of marketplace subsidies now and reduced Medicaid access in years to come will put further strain on our already burdened system. We do offer sliding scale payment options to people who are uninsured, but many just can't afford to pay. The more care we provide without payment, the less able we are to serve our community. Everyone needs access to health care. As a federally qualified health center, we are working hard to maintain access to primary care for members of our community who might otherwise go without. We are an important part of a system of healthcare providers in Lane County who are working to assure that every person living in our county can receive the medical care they need. We know that as a community, we are still far from that goal. It is difficult to find a primary care provider, no matter your insurance. Wait times in emergency departments are long. We have long waits to get into local specialists, with some booking appointments 6 to 8 months in the future. Our system cannot keep accepting the strain of being asked to do more with less. We need help in order to serve our community. It is vital that we assure everyone in Lane County has access to affordable health insurance. When people are uninsured, it doesn't just impact their ability to access care. It also reduces funding available in an already very strapped system and puts healthcare access at risk for everyone. And now I'd like to introduce our Public Health Officer and Chief Medical Officer, Dr. Pat Lemke.
Thank you, Evie. Thank you, Senators. As the certified old guy, I get to do a little history here, a little historical view.
I appreciate you recognizing my youth. Thank you very much.
So 25 years ago this month, the Institute of Medicine, I think many of you probably know the IOM, it's a congressionally chartered entity within our National Academies of Science, began research on a multi-part series which they called the consequences of uninsurance. This is not a new problem. The resulting 6 publications, released over a 4-year period, reviewed the evidence and reported on the effects of not having health insurance in this country. The main findings of the report, and I'm summarizing hundreds of pages of data, the main findings were that working-age Americans without health insurance were more likely to receive too little medical care and receive it too late, be sicker and die sooner, receive poorer care when they were in the hospital, even if it was for acute issues such as a motor vehicle crash. Specific findings, drilling down a little bit further into some of the finer detail, revealed that there was less frequent or even no use of cancer screening tests, resulting in delayed diagnosis, premature mortality for cancer patients, care that did not meet professionally recommended standards for chronic disease management, including, for example, the failure of persons with diabetes to get timely assessments of eye and foot examinations to prevent blindness and amputations, the lack of access to maintenance and appropriate medication regimens for persons with something as mundane as hypertension, and fewer diagnostic and treatment services for trauma or heart attacks, and an increased risk of death when someone was in the hospital. So fast forward a decade. 10 years later, 10 more years of research ongoing trying to understand this problem. In 2009, an updated review was taken of literature that was published during that 10-year period. The resulting publication was titled America's Uninsured Crisis, Consequences for Health and Health Care. It reported the following. The clinical literature overwhelmingly shows that uninsured people, children as well as adults, suffer worse health and die sooner than those with insurance. Number 2, families with even one member who is uninsured lose peace of mind and can often become burdened with enormous medical bills. Number 3, uninsurance at the community level is associated with financial instability for healthcare providers and institutions. We've seen that, as Eve mentioned, a hospital closure, multiple pharmacies closed, multiple clinics closed, including reduced hospital services and capacity, significant cuts in public health programs, including cuts in programs such as tuberculosis, which I, as the health officer, deal with for the entire county. Program cuts flow downstream. Also, economic vitality of communities and the nation is limited by these productivity losses that result from poorer health, premature death, or the disability of uninsured workers. So fast forward to today, October 2025. We find ourselves in a government shutdown linked to the expiration of tax credits for healthcare premiums for an estimated 24 million Americans. In Lane County, that translates, my math is a little bit fuzzy, I'll count on the senators for better math, maybe 10 to 15,000 Lane County residents who may be at risk, including 3,000 to 4,000 who may fully lose their insurance. You've already heard of the increased costs for those 10 to 15,000 people. But remember, some people will be beyond the 400% federal poverty level. They will completely lose their health insurance and have to find another way. It's worth noting, I think, as well, that those 24 million Americans that are relying on this service, they're not just unemployed people. They're not just poor people. They include farmers and ranchers, self-employed people, business owners, and many in the gig economy. If we know anything from the University of Oregon and events, we know there's a lot of people in the gig economy. We know that there are coders and writers and Uber drivers and Lyft drivers. There's a lot of people in the gig economy that really struggle for coverage. So, excuse me, many years of research have shown, over the last 25 plus years actually, that the lack of health insurance has profound and far-reaching consequences, ranging from higher rates of premature death and late diagnosis of disease to poorer quality of even inpatient care. This crisis is not limited to individuals. It extends to families burdened by death. It includes communities facing instability in healthcare services and states diminished by lost economic activity. These are issues that we already face today. They almost certainly get worse if we don't continue down the path of providing healthcare to those most in need. Thank you.
Well said, Pat. One last point. Senator Merkley and I are part of a Democratic caucus that wants to work with Republicans and get this straightened out. And we know how to do it. We know how to write bipartisan health care legislation. Some of you have covered what I did in the Finance Committee 26-0 vote to rein in these pharmaceutical benefit managers. That would allow us to save billions of dollars. That's what we're talking about, the chance to sit down, work something out in a bipartisan way, and there's proof that we can do it. Let's have some questions for our group, and we're all available to you.
Can Chris, sorry if you said this, I didn't quite catch it. You were explaining this like new health plan that you were looking at. What was that? Like, I'm confused by the process of, you're losing the subsidized health insurance. What happens next? Can you explain?
We're just losing the subsidy. So each year you go on the marketplace and they give you options ranked on bronze, silver, or gold plan. And based on, we actually have to pick our health insurance coverage based on our finances, not on our needs. And so that plan won't necessarily go away or whatever, but it will go up. They have gone up every year since my beginning. So we'll have to go on there and pretty much based on what we feel like we can afford, pick our plan, but not based on our medical needs.
Other questions?
Sorry, Chris, what's your last name?
Bratton.
Other questions? We'll let everybody get there first, and then we can get our friend from the garden. Yes.
Oh, so how confident you are that things might be resolved? If you look at like the dynamics of the walkout and when the Senate comes back in.
What I hope is that we've been out for a few days, and Republican senators have been home with their constituents. And I think those Republican senators are going to hear what Oregonians heard today, is that typical people are about to get hit by a health care wrecking ball. This is going to make it hard for them to pay rent and buy groceries and the like. What we're saying, the two of us, is we're available immediately to sit down, work out a bipartisan agreement, and I just gave you an example of the last major health care bill that was advanced in the United States Senate to save billions of dollars that both sides could find common ground on. So that's what we're hoping we'll see. The two of us are going to be back there tomorrow, and I stayed extra on Friday just to see if we could maybe find some common ground. So the two of us are in this in the Budget Committee and the Finance Committee. I'll let Jeff make any comment he wants.
Well, last week, a number of Republican senators were telling us in individual conversations how concerned they were about the massive impact of what they voted for when they voted for what the president called the big, beautiful bill, and we called the big, ugly betrayal. Why do we call it a betrayal? Well, because Trump campaigned on helping families, but the bill savages families in order to do tax breaks for billionaires. So those individuals who are coming across the floor and saying, well, we do understand that this is going to hit our folks really hard who are buying on the exchange, and they're not going to be happy when the new rates come out, and the new rates are coming out state by state, but a lot of them are coming out this week. So the pressure is building. The pressure is also building because the president's strategy has been to essentially make things really hard for federal workers, and we're starting to see the impacts on that. It was Russell Vought, the head of OMB, said, my goal is to traumatize federal workers. I want them to feel like victims, so they won't even want to come to work. So they're in the process of executing that vision of attacking federal workers. What are we starting to see? We're starting to see that the air traffic controllers, some are calling in sick and saying, we are so stressed, we're understaffed, we're underappreciated, and so we're starting to see flight delays. We're seeing other workers weigh in and say this is outrageous that this strategy of attacking those of us who are deliberately serving our government to make things work for people in America in all kinds, whether it's in transportation or it's in healthcare or it's in housing policy, trying to make things work for America. So I think the pressure is building. Republicans are going to come back and say, right, we're going to fix this. We're going to work with you to fix this. And like I said, we are holding strong. We are not going to reopen. We're not going to help the Republicans reopen the government while they are savaging health care for millions of Americans.
If anybody needs anything else, we'll try to stick around for a few minutes, but we're juggling those airplane schedules that Senator Merkley talked about.
question, and then we're gonna.
Okay, great. One last one.
Go ahead.
For Eve Gray, I'm wondering how the shutdown might be impacting COVID vaccine shortages in the state.
That might be a better question for Dr. Lundke. I have not heard of the shutdown impacting the COVID vaccination availability, but you may have.
I would just say that we do not have a shortage of COVID vaccines in terms of the volume of vaccines, the types of vaccines. However, as you likely know, it was only a couple of years ago that Bi-Mart closed 56 pharmacies. We've had other pharmacies close in consolidation, so there's the access to some of the points where you can get a vaccine has clearly decreased.
And the indictment of the federal system for vaccines is now very clear, because Oregon, Washington, and California have basically said, we're not going to sit around and watch any more Robert Kennedy nonsense, where he makes it hard for people to get access to vaccines, number one. And as Pat said, and I'm hearing with my investigators, that small pharmacies are getting clobbered by these vaccine practices, and you'll be hearing, I think, more on that at KVAL here coming up, because they're really unhappy. We're going to have to zip. To be continued. Thanks for coming out on Monday.
Thank you all.
Bravo. Bravo for our team. Pat,
Thank you so much.
Thanks for bringing that expertise to bear. The numbers I heard were 2,500 in Lane County, we're losing strength, but the other I'm just building on the
Just hearing about you guys in November 1st.
Thanks for having us. Thanks for